In January of this year, there were about 320 million people in the United States. And in that population, 133 million people have chronic pain. That's a lot of people that are suffering.
In the U.S., the most recent study, workman's compensation spends about $7 billion on just chronic pain patients. $1.4 billion of that is spent on the drug component of that.
85% of all narcotics in the world are prescribed right here in the United States. Typical pattern for a pain patient is from the date of injury, they'll appear at their family practice doctor. The family practice doctor will evaluate the patient and do an x-ray. 80% of all x-rays in the United States come back negative, and they prescribe a medication for pain and they send them to physical therapy. A couple of weeks into the physical therapy appointments, the patient quits going to physical therapy, so they wait out their 2 weeks, and sometimes they run out of their pain medication early, and they go back to the doctor and say, well, I'm out of pain medication, I didn't complete physical therapy, and I'm still hurting. And the family practice doctor says, well, I'm gonna refer you to a orthopedist. And the orthopedist will see the patient and says, we're gonna redo our x-rays, and they come back negative. And so he says, well, we're gonna order an MRI, and I'm gonna give you another prescription for pain medication. They repeat that routine with the same results. And typically on the 90th day of being there, the orthopedist will refer to an interventional pain physician. Then they repeat it one more time. The patient's been on pain medication for about 120 to 150, 60 days, and they're physiologically addicted to their pain medication at that point. We offer a 20-day intensive outpatient program where patients come and they get 8 hours a day of treatment, 5 days a week, for about 4 weeks.
Half of the program is in group with me, doing the psychological and emotional component of helping these people get well. And the other half of the program is the patient being out in the gym and learning how to do movement, stretching, the goal being to increase strength, flexibility, and stamina. Thoughts, beliefs, and feelings create reality. And so when a person comes in here, what have their thoughts and beliefs and feelings been? My life's terrible, I can't do this, I've lost everything, and guess what? That's their reality. When they begin to change their thoughts, beliefs, and feelings, their reality changes.
The reason that this program is around is because of the outcomes. We get 77% of the people back to work. We think that's going to get better. I think it's going to be closer to 80. We get about 65% of them either off or greatly reduced off any kind of narcotic medication. Huge transformational things for the workman's comp carrier.
We see people in this pain management program that return to work even after 6 and 7 years post-injury. And from day one, while they're in the program, we teach patients the importance of returning to work and not going on disability, but keeping patients from thinking that I need to be on disability. So if you can return a patient back to work that's been on medical benefits, then there's an automatic social benefit to that and an economic impact to the carrier and to the patient's family.
Functional restoration, the work that we do, and one of the things I loved about the business model was that everybody wins in this scenario. The economics of it work. The payers, save their money, the patients get back to work, the physicians are getting their job done. In our model, the more we do, the more money that gets saved. That creates some longevity and really one of the most unique things I've ever been involved with within the healthcare industry.
When I see patients that come in really at the bottom, whose lives have fallen apart and they're not thriving, what we get to do is we get to put them in this pain program and really watch people blossom and come back to what they were prior to their pain.